Can you see the slide? If it is not visible, you let me know, okay? So when we say the female pelvic bone, this is a bony structure. You know right where it is located? Every male and female, they have pelvic bone, right? But we are studying pelvic bone in maternal nursing because it has its significance, okay, in childbearing, right? That's why we are studying it specifically. Okay, so this female pelvic bone or the pelvic bone is this bony structure near the base of the spine, right, to which our legs are attached, as you all know. And this pelvis, it is like a basin, right? It is like a basin, it is hollow, it is a cavity, and it supports our leg, and it is formed by the ilium, ischium, the pubis, the coccyx, and then the sacral bones. Okay. So here, what are the functions? When we see the functions here, it is because of our pelvic bones, it allows the movement of the body, right? Because of this pelvic bone, your leg, right, the femur, the cerebellum, it gets attached there. Then you can walk around, you can move around, right? Because with the help of the pelvic bone. And then, as I've already mentioned, it has a very significant role in childbearing. Okay, and then this pelvic helps to transmit the weight of the trunk. Okay, our body weight to the legs. That is why we have an equilibrium, right? You don't tend to fall off. Even if your upper body weight, the trunk is much more bigger or it weighs more than your leg. Even so, equilibrium is maintained. Okay, stability. And then when you sit, it is the pelvis that takes the whole of the body weight. Okay, and then this pelvis, okay, it is a bony structure, it's a bony cavity. So whatever is inside, that is the uterus, okay, the fallopian tube, these pelvic organs, and then some parts of the abdominal contents. Okay, it protects it. Okay, this pelvis, it protects it. So these are some of the functions that that the pelvic bone performs in our body. All right, and then in the pelvic bone. Okay, in the pelvic bone, you know, right? You have seen this, right? This pelvic bone. Have you seen it? This pelvic bone. So this pelvic bone, okay, this pelvic bone, it consists of these two innominate bone. This is the innominate bone. All right, this is the innominate bone. Then we have two innominate bone, and then the sacrum, and then the coccyx. Okay. So you can see, right? So this one, okay. This is the innominate bone, as you can see. Okay, this is the innominate bone. Then we have two innominate bone. Okay, it consists of two innominate bone. Okay, then the sacrum, and then the coccyx. Right. So these are the four parts. You got it? So here, as I have said, the pelvic bone, it consists of two innominate bone, okay, or the hip bones, then one sacrum and one coccyx. You got an idea? Is it clear till now?
Yes, PM. Yes, yes,
Okay.
ma'am. Just not clear.
So again, this innominate bone, okay, this innominate bone is again divided into the ilium, the ischium, and then the pubic bone. Okay, the ilium, the ischium, and then the pubic bone. Okay, this innominate bone. Okay, we are talking about this particular part. So this is again divided into three parts. Okay. This is divided into three parts. We'll be talking about it. Again, this is divided into three parts. Okay, you can see now. So the ilium, the ischium, and then the pubic bone. It will be divided into that. Okay, this one. So now let's see one by one. Please let's see the innominate bone. Let's study the innominate bone. All right. So here the ilium, that is the upper part, okay, the flare out part that I have indicated. Firstly, this one is when you place your hand in the hip bone, right? When you place the hip, that is where your ilium is, okay, the iliac crest. So this demonstration I will be doing when you come to when you join physically. So you can just note all this down for now. So this ilium, okay, this we have a prominence. All these things I will show you. Okay, so for now you just listen. Okay, so it has a bony prominence. We have this anterior superior iliac spine, and then it also has a short distance. Okay, just below the anterior inferior iliac spine. Okay, and then there are two similar points. Okay, iliac crest. We have right and left iliac crest. Right, because you have your right hip bone and your left hip bone. Right. So, and then the concave part is the iliac fossa, concave part, okay? This part is, this part is concave, right? When you feel it, this part is concave, right? So this is the iliac fossa, okay? As you can see here, this is the iliac spine. This is the iliac spine, okay? This concave one is the iliac fossa, okay? And then posterior superior iliac spine will be here, okay? When you really see the pelvic bone only, then you will understand it, okay? In picturizing, while picturizing, you will not understand. But to move further with your subject, I have to take this one. That's why I am taking it, okay? I'm giving you a brief idea about the pelvic bone. Now coming to the ischium, okay? This is the second part, okay, the middle part, okay, where it is taken out. So we have here the ischial tuberosity, where when you are resting, it is on the ischial tuberosity, you are resting when you are in a sitting position, okay. And then we also have an ischial spine, okay. And then let me show you here. The tuberosity, okay, you cannot see here, but it will be somewhere here, okay, in the inside. And here we have the tubercle here. Okay, so it is through this ischial spine that this ischial spine, with the help of this, we are measuring the station of the head, right? When we are doing pelvic examination, PV. So this is ischial spine, okay? So here, as this is only a 2D view, that's why we cannot see, or else at the back, okay? At the back you will find out like this. It is where your body is sitting at, okay? When you are sitting at this. So this is the ischial tuberosity, okay? In this region, it is covered here, but in this region you will find. So that is the ischial spine. So that is what your ischium is. Now coming to the pubic bone. Okay, the pubic bone is the anterior part of the pelvis, okay? So we have the superior ramus and then the inferior ramus, and then the place, the junction where the pubic bone meets is the symphysis pubis. Alright. You can see here, right? The symphysis pubis or the pubic symphysis. Here. Okay. This is the pubic symphysis where the two pubic bone, okay, the left and the right, it meets. Alright. So now coming to the sacrum, we have already now described the two innominate bone. Okay, and now coming to the sacrum, this sacrum is a wedge-shaped bone, and it includes 5 fused vertebra. Okay. Yes, you can see here. Here. This is the sacrum. Right. So here you will find the sacral promontory. Okay, this will be the sacral promontory, and this area is the ala or the wings of the sacrum. You will find it here. Okay, and then these are the foramina where the nerves and the blood vessels pass through. Okay, this foramina, this whole thing that you are seeing now, these are the foramina. Okay, where the blood vessels, the nerves and all will pass through. Alright. And then we have the coccyx or the vestigial tail, we call it, right? The tail. So here it consists of 4 fused bones. Okay. Earlier in the diagram you have seen that it consists of 5 fused vertebra. Here in the coccyx it consists of 4 fused vertebra. Okay, it's a small triangular bone, and then here you can see here in this area you can see, right, this is the coccygeal bone, okay, or the coccyx. It is formed by